Dr. Givens here with Givens Facial Plastic Surgery in Austin, and we're going to talk about the eyelid lift, or more medically known as the blepharoplasty. It's one of my absolute favorite procedures to perform on patients because they get a huge immediate result that they really love, and it lasts for decades. So when we're talking about a blepharoplasty, or I'll just refer to it as an eyelid lift, we're basically talking about either the upper eyelid or the lower eyelid. And the procedure can be done individually on just the uppers or just the lowers, or it can be done simultaneously on both. But the reason you need them is variable. So when we're talking about the upper eyelids, we're really talking about getting rid of any excess skin and bulging fat pads that over time have begun to protrude or sag down. You'll notice with your skin, it can be as little as you're just really having trouble putting on your eyeliner. Your eyelid anatomy looks like it's different from when you were younger, or you can have so much excess skin and fat that it starts pushing down on those eyelids and can even create some visual problems peripherally or out to the side, depending on how severe that excess hanging of the skin and fat is. We correct that through a very simple incision through the eyelid crease that swings up a little bit, that heals very imperceptibly scar-wise, and you really have complete rejuvenation almost immediately. There is a small downtime process, but otherwise it's a pretty easy recovery. The lower eyelid, on the other hand, that is more when you have excess muscle hypertrophy, meaning bulging muscles, or those hollows with the bags that are created with them. So if you have really saggy bags and bulges that are starting to form with maybe a little tear trough deformity right here, you're a great candidate for lower blepharoplasty or a lower eyelid lift. That's also made through a hidden incision as well. It can be made on top of the skin or inside the eyelid, depending on how your anatomy is. And then we basically will remove any excess muscle, excess skin, and then most of the fat pads. If you have a little tear trough right here, meaning a crevice or an indentation, we can use some of that fat and really lay it over so that it effaces it, so that it blends very well into your face. So that's the dynamics of the upper and lower blepharoplasty or eyelid lift. And if you're ready to transform your life, it's time to call me at 737-787-8200. Until next time.